The healthcare crisis that is being felt by many provinces across Canada is also being felt at a national level. Joining me now to discuss what various provinces and the government of Canada could perhaps do to help with the healthcare crisis is Dr. Katharine Smart, President of the Canadian Medical Association. Dr. Katharine Smart, thanks so much for making the time as always, and good to have you back on the program. Let's just start out with the first piece I mentioned. What should various provinces be doing to deal with the healthcare crisis that is being felt in many hospitals across Canada as of right now?
Yes, well, as you've said, we are really truly seeing this crisis across the country. And I think there's many things our provincial leaders could be doing to help. I think, the first part of the problem is really defining what the problem is and showing some leadership to take ownership of the problem. We're hearing a lot of dialogue from the premiers that this is only about funding and that they're looking for the federal government to come in with the Canada Health Transfer. And that's really the only thing we're hearing right now in terms of solutions. But what we know is we're already spending a lot of dollars on our healthcare system. And really, we've got some fundamental systems issues that need to be resolved that go beyond just dollars. So I'd like to see the premiers really acknowledging that and starting to take some steps to addressing the human health resource crisis, which is really fueling what we're seeing right now in our emergency departments, and also the primary care crisis and issues with access to things like long-term care and home care that are backlogging our hospitals and really causing challenges in the emergency department. So there's lots of opportunities here, I think, for them to come up with solutions and work with us to advance them.
And I mean, one example of a question that I want to ask you would be in the province of Ontario with Bill 124 as it relates to capping public sector workers' pay, including nurses. So I guess what do you make of, I guess, specifically Bill 124, but also just the general idea of, the wages that healthcare workers are being paid? And do you think that can ultimately be contributed at all to the healthcare crisis that, they're not being paid the amount that they, would ideally like to be?
I think that's a huge issue right now in the nursing profession in particular. And we know that one of the biggest issues around the human health resource crisis is with nursing. And we're just seeing huge attrition of nurses from our hospitals. And I think some of that does relate back to the morale related to things like Bill 124. Here we have nurses who have been on the front lines of this pandemic for 2.5 years and have their wages capped at 1% raise per year, which isn't even keeping up with inflation. And I think that's really challenging. We're seeing a lot of hospitals fill in the human health resource gap with agency nurses who are paid a lot more than nurses that work full time to our hospitals. So that's contributing to morale issues. So I think it would go a long way as sort of an act of good faith for the government to increase pay for nurses in recognition of the expertise they bring to our system, and also to promote retention, because right now that's our biggest problem is we are not retaining the healthcare professionals we have.
And what ultimately do you see as the pathway to end this crisis? And I guess what can various governments do to help to put an end to the staffing shortages and just, again, the healthcare crisis in general?
I think we really need to start to see more collaboration between levels of government. We're still stuck a bit with the finger pointing, provinces blaming the federal government sort of saying, well, the provinces are the ones that have to deliver the care. The reality is this crisis has gotten to a level now that no one government is going to solve this independently. So I think if we could start working together around these things, we could see some solutions. So we're calling for a national human health resource strategy. We need to dig in on retention. Some of that's creating safer and better workplaces so people feel that they can continue in the healthcare system. Addressing wage disparities, things like Bill 124 in Ontario would go a long ways. I think bringing healthcare providers to the table, acknowledging their experiences would be really important. Right now, I think a lot of the frustration is coming from hearing political leaders make statements that everything's okay in the system when the people in it know that's not true. So I think getting aligned would be really, really important. I think there's opportunities in the community to do more advancement of integrated primary care models that would really improve care for patients and allow us to retain family doctors, have more other healthcare professionals working together with family doctors to create better access to care, and that will be really important. And then, of course, there's other issues we need to address, like the crisis in long-term care, access to those beds, scaling things like home care also. And that's another place, I think, where the federal government and the provincial governments could be collaborating.
And that is the president of the Canadian Medical Association, Dr. Katharine Smart. Dr. Smart, as always, thanks so much for your time and great chatting with you once again.
Thanks, Wyatt.